hand this over to you.
Okay, perfect. Okay, so this is Medicare.gov. This is the front page you will see when you type in Medicare.gov. I almost said .com. Medicare.gov. So want to, like I said, just touch on a few things. So first thing I want to talk about is creating an account, or creating an account for your client, or having your client create an account. So there's a lot of helpful things that you'll be able to see with an account. Kind of over here, some touch points. Something that I get asked a lot by agents is, I have this prospect or I have this client and we're not sure when the Medicare Part B effective date was, or Part A effective date, or whatever it may be. Having an account on my Medicare.gov will tell you that. And so you get a summary of your current coverage, as well as it allows you to save your drugs in your pharmacies, and all that good stuff. So you do need a Medicare number to, I'll show you what this looks like. You do need a Medicare number. So you need your Medicare card, or at least a Social Security.gov account to where you can access your number if you don't have it yet. And so this is as far as I can get today, but you do need your Medicare number, Part A effective date, and then you can keep moving forward there. So yeah, this is a great resource for your clients to have, just to be able to find certain information that they may need.
Yeah. So if an agent doesn't have a Medicare number, but they kind of want to mess around with the Medicare.gov, is that something where it's like you either have to use someone's account that does have a number, or you just kind of, okay.
Pretty much. They have this little disclaimer here, I don't have a Medicare card, and so it gives you other ways to find your Medicare number.
Got it.
But yes, you do have to have a Medicare number to even have an account. And
Cool.
so
Okay.
if you're not Medicare age and you don't have one, if you don't have access to your clients, you'll just need someone who has that to be able. I don't believe they have any sort of like admin access. This is purely client facing for your clients, knowledge.
Yeah, I think that is one thing that's good to note about Medicare.gov is Medicare.gov is made for clients. It's made to be client facing.
Mm-hmm.
So even all of the like jargon and like wording that they use is going to be a lot more user friendly than CMS.gov. And I know that that's one big reason why internally we use Medicare.gov, because it's so much easier to understand than CMS.gov.
Yes, it is. And so, like I said, I use this every single day. Agents calling in, asking how things are covered, when coverages start, how it works with employee group health plans. And this is where I come to find that information. And so, yeah, definitely, just like Sadie said, it is made for clients. So it's pretty user friendly, the whole site. Another thing I'll point out is the chat feature. I don't use this as often, but it's there. You can have a guest one, or you can, link it to your account. I think my thing to this, if you have a question for Medicare.gov, call us instead, and we'll be able to help you probably quicker than maybe this chat feature will. But it is there if your client wants to, or if you want to kind of just check it out. Something else that I should have pointed out first, they do have this switch to Spanish. So they do offer this site entirely in Spanish. And so this button up here changes the language.
Nice.
If you have clients who speak Spanish, you can kind of point that out to them.
Awesome.
Okay, so last thing I want to show just kind of on this main page is where clients can sign up for the newsletter. It's a weekly newsletter, important news updates down here. They just need to enter their email address, click this box, and then go from there. And they'll get their, I believe it's weekly kind of just newsletter from Medicare.gov. If that's something that they're interested in, we'll definitely keep them in the loop about important changes. As you can kind of see, there's two things on here that they would probably hear about: the Medicaid redetermination that talks about, there's a little article right there, as well as the insulin changes. So yeah, lots of things changing. in the industry, and they will continue to change. And so just a good way to keep your clients kind of in the loop. Okay, perfect. So that was that first little tab. Next one, you can definitely find drug quotes, MAPD, you know, the whole 9 yards here. We have Medicare Center, and so of course I'm always going to plug Medicare Center. So I'm not going to walk through the steps to run a drug quote on here, but you definitely can. You would click this, and then it would just prompt you for all of the typical information that you would run for a drug quote.
So before we move on from that,
Yes.
not to put you on the spot, but what are some reasons why someone would want to use Medicare Center over using the Medicare.gov quoting system?
I have found that in several different instances, the Medicare Center is just a little bit more accurate. I definitely use this occasionally when I want to double check my work in Medicare Center, basically. Or if I'm having difficulties pulling up a drug in Medicare Center, I'll hop over here and see if it pulls on Medicare.gov. Cool. So I definitely use it, but Medicare Center is definitely my number one, just because of, you know, the other features and the entire, you know, CRM aspect and just the call recording. It's just a whole platform that, you know, Medicare.gov does not offer. So definitely going to push Medicare Center for the drug quotes, but it is here for sure.
We do have a few questions. If you could click over here really quick on Mike's question. Mike is asking, I watched the session yesterday. How do I get into the section for AEP as demonstrated? So I believe you're talking about the AEP toolkit. If you go to our website, smsteam.net, on our homepage, if you scroll down, there will be a banner that says AEP toolkit. Click on that, and it has all of those AEP and MAPDP resources that you can find there. That's what we spent most of our time on yesterday. So just go to our website and you'll find it right there on the homepage. Let's see, Mary has a couple of questions. Good morning. Do we have a guide that tells us the clicks the client has to do to find their current coverage? I use Medicare.gov to show in and out of network amounts for MA plans since Medicare Center only shows in network. Have you ever found clients to decide to do it on their own once you show them how to log in?
I mean, yeah, there's going to be people out there for sure that would prefer to do it on their own. I rarely talk to clients directly. I just talk to the agent. So unless I'm hearing that from an agent, then I wouldn't necessarily know. But I wouldn't say that I have ever heard that really of the client kind of wanting to do it on their own. I think there's a lot of value in an agent and, you know, an advisor role. And so sure, you're going to come across those people that want to do it on their own, but I think there's a lot of value in having an agent. And so I wouldn't hear of anything like that.
I think that opens up a whole nother conversation. One, it's either the client's just going to do what the client's is going to do, or they don't see value in what you can help them out with. And Mary, I know that you've been doing this for a while, so I'm sure that you don't run into this problem, but you know, there's lots of other ways, lots of other retention things. What else are you helping out with? What education are you giving them on the things that, you know, the gaps in their coverage that they wouldn't find out on their own through Medicare.gov unless they were just super intuitive and knew a lot about this sort of stuff. But most of the time, people will probably, if they're in your office, then they're wanting your help. And Medicare.gov can really help clients, but also if they don't have someone to help guide them through it, it's still kind of, you know, a government website. So that's a good question, but I don't think it's as big of a threat, I wouldn't say, as maybe it might feel like it.
No, I wouldn't say either. To your first point, a guide that tells us the steps to find current coverage. Let me see if I can find that. Like I said, I don't have access to it just because I don't have a Medicare number, but I'm sure that someone in the office, you know, has access to one or knows so let me we'll write that down and I'll see what I can find for you, Mary, on that first part. And then this next one, how is Medicare.gov for finding care providers? excellent. That was where I was going to go next, find care providers.
Yeah.
So I'll touch on that. But yeah, this is probably one of the things I use the most on here.
For sure, yeah.
So yeah, it's a great tool for that. Do we want to touch on this one first?
Yes, and Mary, another Mary, will we be shown how to run a drug quote on Medicare Center? So we actually don't have time to do that this week, but don't worry, we do Medicare Center webinars a few times a month. I will, at the end of this week, whenever I send out the follow-up email, I will link the most recent recording of the Medicare Center walkthrough, so you can watch that video if you want. And also, please feel free to call into our office, and we're happy to walk it through you too, as much or as little information as you want on how to do that. But we can't this week, unfortunately, but we have plenty of resources that we can help you out with that. So
yeah, definitely. I was going to say, if you have questions, call our office, call the agent resource team. I walk through quotes all the time.
Mm-hmm.
So yeah, definitely something we can help you with, Mary. Okay, so moving on to finding care providers. So click here, and this is what you'll see. Also, this may look different. It's on dark mode, and we can't figure out how to turn it off. So that's why this may look dark. Couldn't figure out how to turn that off, but it's all the same information anyway. Okay, so as you can see, you can choose here what exactly you're looking for. And here's a little, if you want to learn more about the different types of providers, they have, further assistance there. I'm just going to go doctors and clinicians. I'm going to do our zip code here in Columbia. They have a drop down. This is optional, so if you're not sure, then you can leave it blank. Most people, I feel like, know what they're looking for. I'm just going to do PCP, and I can kind of show you what you'll see. So this is what it's going to look like. This is what we just searched for. So if you want to change your location, change your provider type, you can do that up here and then research. Here are several different filters. You can kind of just get this as specific as you want. So I'll kind of touch over this. Kind of, as you can see, there's these little disclaimers, and I'll touch on that. I will say this isn't my favorite filter, because it only allows you to filter for providers who accept Medicare assignment, which I guess you wouldn't want anything other than that. But here in Columbia, there's a lot that do. And so I'll kind of switch over to a different area to show you what this may look like if they don't accept Medicare assignment. But yeah, so then other filters, and then you can go even more. There's a few other ones you can kind of choose from over here. But this is what you'll see. So it filters it by closest. You can switch that if you want to go alphabetically, but it'll have their name. If they have multiple group affiliations or locations where they serve, that'll be listed as well as their contact information, and then their specialty. And so what this is down here, it says charges the Medicare approved amount, so you don't pay less, or so you pay less out of pocket. So what that means is this doctor accepts Medicare assignment, meaning they won't charge you anything over than the Medicare approved amount. If this said something else, and I'll go ahead and switch over. I know I did Jeff City earlier. There was several that said may charge the Medicare approved amount. And so basically what this means is I would recommend just calling this provider and being like, hey, do you accept Medicare assignment? Because if not, then you could be subject to paying, I believe, 15% more than, what you would otherwise. So definitely something to look at when you're looking for providers. Like I said, clients definitely don't want to pay more than what they need to. And so this would be a good example of when this filter would maybe come in handy when there's a lot listed. And then you'll just see the ones that'll accept it.
Yeah.
So
We do have, Mike is asking, does it tell what companies' plans they accept? So will it tell like what companies are in network?
I don't believe it does. But this is the part, I don't know exactly what this happened. This is the part, okay, no. So it doesn't on Medicare.gov, but this is the part where I was gonna plug AEP Toolkit a little bit. And so this is our AEP Toolkit. Mike, here it is. And so what we do have kind of encrypted in here on the different carriers is carrier specific provider searches. And so if you have a client who knows they want an Aetna plan and you just need to check their providers, it would be a lot easier to come and just look directly at Aetna's provider directory to see if that doctor accepts or is in Aetna's directory.
Yes.
And so we have that for all the carriers that we have available. Like I said, it's on Aetna. I believe United Healthcare has Rally, which is a great tool on Jarvis, and I believe it probably should be linked as well. Yeah, and so you'll see provider and formulary lookup down below when you click on whichever carrier you decide. And so if you need to look at a specific carrier, I definitely recommend coming to the AEP Toolkit and following these links rather than being on Medicare.gov, because Medicare.gov doesn't give any sort of carrier information. Good question.
Yeah, that's a good question.
Okay, so that is the provider search. Yeah, pretty easy to navigate. There was one other thing. So you'll see this little pop-up, next steps for choosing a doctor. And so just kind of outlines, what to do next. There's also a little more answer section. And so this is a point I wanted to touch on. It talks about the Medicare approved amount, so Medicare assignment. That's something that can get pretty confusing pretty quick. And so there's just a lot of little helpful, like, what does this mean? Click here to find this answer. Medicare.gov is covered in those. And so just a lot of really great information to be found here if you know where to look.
A lot of times we highlight that whenever we're talking about quoting like plan ins and stuff like that. So if you've seen any of our webinars where we talk about, we've had plan in webinars, this might look familiar to you, because whenever you're quoting plan ins, that's a super helpful tool for sure.
Definitely. Okay, well, perfect. So that's finding provider care. A few other things I wanted to kind of highlight on this main page. If you go under basics, specifically these two are the ones I want to talk about. So the Medicare and You handbook, get these questions all the time. You can come here, get the download the PDF. If you want the ebook version, then you would just need to have an account. Another thing you can do in your My Medicare account is choose how you receive those updated ones. And so you can choose to just like change how you're getting them. If you're getting them by mail and you'd rather have them electronically, you can change that in your My Medicare.gov account. So I get questions a lot on how to access this.
Yeah.
And it's right here. Right there on the basics. Also want to touch on forms, publications, and mailings, specifically mailings. And so clients are getting a lot of stuff in the mail, can be really, really confusing on what means what. And so this is a really great resource to kind of, I guess, figure out exactly what they're getting, signing up, what the costs are. This is another point where I want to plug something on our toolkit. So we're back on the toolkit. If I go down under appointment worksheets, we have Medicare mail cheat sheet for client use. So this is a great piece to have for your appointments that you have with clients. And it's, like I said, it's the dark mode that's maybe making this look a little interesting. Like this typically will stick out a little bit more, but they're color coded. And so oh, your client got something in the mail that's yellow, that means they were auto enrolled.
Yeah, that's nice.
And so really helpful, and it is personalized down here, so you can put your information in and hand it to your client when they walk out of your office. So
Awesome.
So definitely just wanted to kind of plug that. Okay, we'll go back to the home page. Something else that I wanted to touch on and kind of just show you guys how I maybe use this the most is just the search tool. And so I'll get calls all the time of being like, when will my client's coverage start? Or how does Medicare, look at diabetes or whatever it may be. This is a really helpful place. I'm going to do ESRD because I know they have a really good page on ESRD. So whatever you're searching for that comes up with all of these results, you have a client that has end-stage renal disease. Here's literally everything you will need to know about how Medicare works with that, maybe the drugs that are associated with that, or just kind of how Medicare covers that. And so the search tool is a really great place if you have like specific, let's say ambulance, say how, doesn't autofill words. So you want to see how Medicare covers ambulance services. So we'll just type it in and it'll tell us, and it'll tell us that Part B covers it. But then, there's always other information. There's always like if deemed medically necessary. And so this is not going to be the end all be all for a lot of, this stuff. I definitely would recommend if you have further questions on how things are covered, definitely touching base with your provider, but it gives you a really helpful baseline on how Medicare views certain things.
Yeah, absolutely. A lot of times this is like where whenever we're sending agents things in writing, it's like we're going to the search bar in Medicare.gov and we're finding it in writing right there.
Yes.
So it's something that we use all the time.
All the time.
Yeah.
And then another thing, so you can search it, but I'm kind of hopping all over the place. This getting started with Medicare is a really good place to kind of start more. It has just outlines step 1, step 2, all the way to 4. So there are lots of stuff in here that you can kind of reference. I'll highlight this one, working past 65. That's definitely a popular one. How, the group plan will work with Medicare. If I'm still working, what does that look like? What does it look like to get B once I'm done working? Just anything you would, need to know. And so really helpful chart. You're in this situation. Okay, well, this is what you need to know about it. And so just a really good, place for information. So that's one I wanted to, and then there was one other one on here that I wanted to highlight. This was not it. This, when coverage starts. So this is another really good page to talk, or that kind of goes over when your Medicare will start, depending on, whatever situation, if you're in your IEP. And then if I go down here, talks about GEP and then special situations. So I know most of us are probably familiar with special enrollment periods to get on a plan, but there also is SEPs to get Part B and Part A. So if your client doesn't even have Part A, Part B, this kind of outlines the different scenarios in which they are able to sign up. Because if you miss, if you miss signing up for Part B when you're first eligible, you have to wait until you fall into one of these situations. And so I get that question a lot. So this is another just great place. I'm a big chart fan. And so I love when there's charts where it's like, if you fit into this, then this is what you need to know. And these are the next steps. And so this is exactly how that reads. And so it's just really uniform and really beautiful, if you ask me.
Awesome.
Yeah. Okay. So One last thing that I was going to touch on, the search tool, but I believe there also is one up here. Yes, so these two, so under providers and services, what Medicare covers, and so that's a really great place, kind of, you know, as I was searching earlier to touch on what it covers. Also want to plug the app. I believe it's just called What's Covered.
Cool.
In the App Store, and it's basically this just in an app form, and you can type in ESRD, whatever you're wanting to know how Medicare covers it, and it's a really easy, user-friendly app that can, you know, help you as well.
Do you have to have a Medicare.gov account in order to use it?
You don't.
No? Awesome.
You don't.
That's great.
Yeah, so I know a few of our you know, teammates here have it on their phone, and
Cool.
so yeah, no account needed for that. Also wanted to touch base on finding medical equipment and suppliers for DME. This works really pretty much the same way as how the care provider search worked. You type in your zip code. Let's do Columbia. Let's do CPAP machine, and it'll tell me where I can get it.
Oh, awesome.
And that it's covered. Same thing, charges the Medicare approved amount. And so if you have, you know, if you have a client that's needing a walker or needing a CPAP machine, not sure where to go or where to even start, this place is a great starting point to just see what's available and where it's available.
Awesome.
So yeah, honestly, that like pretty much wraps it up. I mean, I could search 1,000 more things to kind of show you what would pop up.
Yeah.
But everything you would maybe need is right here. These tabs are really helpful. Drop down. Oh, Medicare costs. Medicare costs is something we get questions all the time on what, you know, the premium is for this year. And so it's right there on the front page. Also going to go back and plug our Medicare cost sheets that we have in our toolkit right here. We have this one and we have the detailed one. 2024 ones are coming once those are updated.
Yeah.
But yeah, so pretty much anything, you know, that you may need to know, that's just like, I don't know, I wouldn't say that it's basic information, but it's definitely at the starting point.
Yeah.
And so where I start, where a lot of people on our team start, if they just have no idea, always start on Medicare.gov is where I go.
Yeah, absolutely. Well, I think that's what we have as far as information for you guys today. If you have any questions, we'll be here for just a few more minutes. Please feel free to throw them in the questionnaire box. We've had some good questions already today. Mary, let's see. She's telling us how to fix dark mode. Honestly, it is what it is today. Let's see. I see. Okay, yes. Well, all of this should look exactly the same if you were to go to Medicare.gov on your website in dark mode or not. It should show up basically the same on your computer, just with a white screen on there as well. Let's see. I guess that there are a lot of different things that we could search for, obviously, on Medicare.gov. But what do you think is like the tool that you feel you're helping people find the most? Like, what tool on here do you think that you use the most?
I would say that I probably use, I'll go back to it, and now I have to remember how I even got there. I think it was here. I was just there. It was the one about when your coverage starts. Because just we get questions all the time about clients specifically who are still working and don't even have B yet. And so, as I kind of highlighted here, special enrollment periods for A and B. And so I use this a lot. I use kind of when to enroll, get a lot of questions about group coverage. And so I would say a lot of what I'm using this for is kind of the almost like just basic facts and like nitty-gritty details that you know, agents are asking about if they have a client situation. So as
sure.
far as like coverage starts, SEPs I use a lot. Something that else I wanted to touch on. Now, this isn't Medicare.gov. This is actually CMS, and so not really exactly what we're kind of talking about, but the landscapes. I'm
Yeah.
not sure if anyone has ever used the landscape or looked at the landscape, but another thing that I use a ton, especially coming in kind of nearing, you know, AEP. Basically what the landscape is a whole list of every MA, PDP. They also have a CSNP one, special needs plan in whatever state you live in and whatever counties you're kind of filtering for. And so they have an MA, PDP, special needs one. And so I use these a lot. Like I said, not exactly Medicare.gov, it's CMS, but shameless plug for the AEP toolkit underneath CMS landscapes right here.
We have a video actually that Chaylin did a few years ago that walks you through how to read a landscape. So for the people yesterday, we were kind of talking about them a little bit, the people asking questions about them. I will link that video in the follow-up email as well. Y'all, this follow-up email is going to be bulky. It's going to have a lot of resources in there. But yes, we will link that video. It's from 2021. So of course the landscapes will be outdated, but it will still, everything still stands as far as how to read it and access it and all that sort of stuff. So we'll throw that in there.
Yeah.
Okay, we have a few questions and then we will let you guys go. Hi, Anna. Have you had any issues with elderly losing Medicaid and letters from Medicaid not being accepted by carriers due to wording for special enrollment? I've run into this now twice, and Medicaid will not change the wording because policies have been canceled.
I personally have not ran into that, but that is not saying that no one else on my team has.
Yeah.
I'd be shocked if my guy Gio, I know he's on here watching, if he doesn't know anything about this. So Anna, I will make a note and I'll reach out to you about this and just make sure we're on the same page and see what we can do there for you. But I personally have not run into that, but that's not saying that it's not a problem that exists for sure.
Alrighty, and it looks like we have one more question, then we will let you guys go. I cannot attend tomorrow, but the webinar will be on AEP Toolkit. What is the topic for tomorrow? So yesterday was about the AEP Toolkit. If you want that recording, you can wait for Friday whenever we send out the follow-up email, or you can go to our YouTube page. Just type in Senior Marketing Specialist on YouTube. It should be the first video that pops up on our page because we just posted it yesterday. So feel free to watch that. That has all that information. Tomorrow, we will be talking about compliance, fraud, waste, and abuse, all that super fun stuff with our compliance officer, Chaylin Jackson. So he will be here with us tomorrow talking about that. It will also be recorded, so don't worry about that. And then Friday, we will be going over carrier resources with Ben Lavis from the Agent Resources team as well. So if that will also be recorded. So you'll have all these recordings on Friday, but if you are eager to watch them now, you can go to our YouTube page and we'll upload them after each day. But it looks like we don't have any more questions. So Madison, thank you so much for joining us today and showing us Medicare.gov. Please feel free to call us and ask any questions if you want kind of more a one-on-one walkthrough through Medicare.gov and all that sort of stuff. We're super happy to do that for you as well.
Yeah,
but
just call us.
Yes. Thank you all so much for joining us. Mike, thank you so much for the love. We will see you guys tomorrow, hopefully. But thank you.
Have a great day.